Vaccine. It's the buzzword since the onset of the COVID-19 pandemic, but we're going to talk about it within the context of public health management. Welcome to another episode of The PH. I'm your host, Donnell Christian. But before our discussion, let's first go to our terms and definitions. The Centers for Disease Prevention and Control (CDC) defines immunity as protection from an infectious disease. If you are immune to a disease, you can be exposed to it without becoming infected. It also defines vaccine as a product that stimulates a person's immune system to produce immunity to a specific disease, protecting the person from that disease. Vaccines are usually administered through needle injections, but can also be administered by mouth or sprayed into the nose. Vaccination is the act of introducing a vaccine into the body to produce immunity to a specific disease. And immunization is a process by which a person becomes protected against a disease through vaccination. This term is often used interchangeably with vaccination or inoculation. With these terms in mind, let's dive deeper into the COVID-19 vaccines and their impact on public health. Throughout history, vaccines have been used to prevent and end epidemics and pandemics. According to the World Health Organization (WHO), vaccines work to prevent more than 20 life-threatening diseases, and immunization currently prevents 4 to 5 million deaths every year from diseases like influenza and measles. Now with the COVID-19 pandemic, vaccines are again under the spotlight and are considered to be the linchpin to restoring normality, or at least the new normal. Up to July 2021, the WHO estimated that there have been over 188 million cases of COVID-19 globally, and more than 4 million deaths since the start of the pandemic. There is a crisis, and it is hoped that vaccines will help us to make the turnaround we need to get back on track. We have seen this happen successfully in the past, for example, in the case of the poliomyelitis epidemic, where mass vaccination drives, led by the Global Polio Eradication Initiative, decreased cases by over 99% since 1988. This is why several vaccines have been given emergency approval, including the more popular brands like Moderna, Pfizer-BioNTech, and AstraZeneca. While trials are still ongoing to see if these vaccines can totally prevent transmission, the clinical results have proven to prevent death or serious illness from COVID-19. Moderna has reported an efficacy of approximately 94.1% in protecting against COVID-19, and Pfizer-BioNTech has reported 95% efficacy. It is hoped that with immunization, the continued wearing of masks, increased hygienic practices, and physical distancing, the pandemic can be controlled. We discuss this further in our interview segment. We're joined today by Deputy Dean of Graduate Studies and Research at the Faculty of Medical Sciences at the University of the West Indies, Professor Marvin Reid. Thanks so much for joining the show. Why is vaccination or immunization a very important part of public health protection?
When we're looking at what we call infectious diseases that can be transmitted from individuals to individuals, vaccines are an important tool because they can prevent us from or minimize the complications related to those infections, as well as typically what they may also do is prevent or break the chain of transmissions from persons to persons. So those are the main reasons that we will tend to use vaccines for infectious agents.
The COVID-19 vaccine is not the first and certainly won't be the last. There's actually a history of vaccine hesitancy, for example, with the measles, mumps, and rubella MMR vaccine. Do you think there's any difference between the hesitancy for the COVID-19 vaccine globally and in Jamaica?
Not really. Generally speaking, as part of the principle of what we call bioethics, is this whole concept of autonomy, which speaks to the fact that an adult who has normal, what we call reasoning function, should be allowed to make decisions as it regards to their own person or their own body in terms of how they function. And over time, in exercise of that principles, some individuals would view the effects of vaccines to be the effects of vaccines to be bad for them. And so those are some of the basic principles that underlies the reluctance of individuals to take vaccine. So from our side, as healthcare providers, we think that the best weapon, if you want to look at that way, or the best way to counter vaccine hesitancy is really to present the facts or the data so that individuals may make what we call an informed decision. That is, decisions based on weighing the pros and the cons. Traditionally, as healthcare providers or as medics, there used to be a particular way or protocol that we use to disseminate medical or technical information. There have been a confluence of circumstances which makes those traditional routes of information dissemination a bit problematic. So essentially is the advent of social media, the advent of the greater interconnectivity amongst individuals, and the fact that information now is no longer the prerogative of the few, but of the prerogative of the many. So anybody can become a publisher just by the click of a button. The challenge you have, therefore, then, is that you have this system, which is the medical way, traditional way, which tends to be slow, tends not to move at the speed of light, like social media. And so oftentimes what you then find is that you have an information, what we call barrage of information, multiple sources of information, and sometimes it becomes difficult for non-actors, meaning the average person in the population, to determine what is true, what is false. We also have to recognize that sensational news tends to rise to the top because a lot of persons, just by nature of the fact that it is sensational, will tend to propagate it more. Bad news travels faster than good news. And so when you have all of these, it makes the landscape a little difficult to navigate for the average folks. And I think that's part of the reason that this whole idea of vaccine hesitancy is so critical at this point in time, because a lot of it is being fueled because of the fact that we have a lot of negative information being propagated. And this tends to drown out or overcome the real information, so to speak. The other reason is that a lot of issues related to COVID is geopolitical. So what do I mean by that? There's this whole concept of where the virus came from, whether or not it had political or geographical connotations. There's this whole concept of the fact that you may get economic, military, and otherwise advantage if you're ahead of the curve. So if you put that in the mix, you can understand why it is that we will continue to have a lot of doubts as it relates to the vaccine.
And based on scientific evidence, why do you think people shouldn't fear the COVID-19 vaccine?
In public health, what we're trying to do is to devise intervention, ways of doing things that will benefit the vast majority of persons in a particular location. That's why we call it public, as opposed to, say, when you would go to a doctor to have a one-on-one conversation about something specific to your health. So in public health, what we like to do is to weigh what we call risk benefits across the whole sets of individuals. So when you look at COVID as an infection, as a problem, we recognize that it imposes a lot of demands in order to contain it. The best public health measures is restriction of movement, restrictions of, to sense your basic freedom. In addition to that, a proportion of individuals who get COVID actually gets really, really sick and require hospitalization. That is a cost that all of us will have to bear. Of those who really get sick and get hospitalization, a proportion of them will actually die. The proportion that will die will vary from country to country, but it may be as low as 2% to as much as 10%, which means that 1 in 10 persons who get into a hospital end up dying. So you then have to say, okay, so that's the bad part, if it is that you get COVID. So what's the good part? In a sense, do we have a way that we can prevent it? And vaccines is one set of medicines that help us do that. So what are the benefits of vaccines? The benefits of vaccines is that it can prevent the hospitalization. It can prevent you from getting seriously ill. There's no free lunch in life. So vaccines will also have adverse events. Some of those adverse events are trivial in the sense that what they do is like a rash, fever, aches, and pains. But other adverse events will require you to be hospitalized, and even very serious adverse events will cause you death. And so we've heard some of few cases of people who have died. And then what we do is look at the numbers. What are the risks of death from the disease itself if unchecked? And what are the risks of death if it is that you take the vaccine? And when we look at this, we recognize that the risk associated with the disease is so high in comparison to the risk related to the vaccine. And so within that context, the medical community is usually recommending and advocating that individuals, if you sit down and look at the risk-benefit ratio, the risk for the disease far outweighs the risk of the vaccine. And so we're promoting vaccine as a intervention that most people should participate in.
So, COVID-19 aside, there are vaccine protocols that were in place long before the pandemic. What are some of these protocols and how do they help to manage the development and rollout of vaccines?
Okay, so I've interpreted that to say essentially how it is that we go and develop new medicines for, emerging diseases. Um, so vaccines, as I said, is just one of the many tools that as healthcare providers we will use. It's perhaps one of the most effective tools when deployed on a large scale. But broadly speaking, what tends to happen is that there are what we call different platforms or different mechanisms or ways that we will use to create these medicines. So typically what we could do is that we could try to neutralize the infective agent, usually by heating it up or irradiating it, subject it to radiation so it's no longer active. So we call that an inactivated form. And then we will see if your body will create or mount an immune system to that inactivated form, so that when you get exposed to it in the wild or in real life, you have that immunity that you can actually fight it. So that's one strategy or technique. The other thing is that we recognize that how the immune system works is that it creates proteins. You could say it creates guns and bullets that fight specific parts of bacteria or viruses to kill them. And so the key element is being able to try to identify which parts of the organism, which part of the germ that the body will create a strong immune response to and kill it. The ability for us now to be able to identify that has been enhanced because of advancement in science over the last decade or so. So what are some of these advancements? One of the main advancements is the ability to be able to understand what is the genetic makeup of the organism. And why is the genetic makeup important? The genetic makeup represents the blueprint of the organism that will determine all the molecules and chemicals that it actually makes during life. So if you understand its genetic makeup, you can then, in a sense, be able to figure out all the particular proteins, all the particular chemicals that it will need for life. And you can test those to see which one of those your body will produce an immune response to. And that's essentially what happened in the development of the COVIDs. We have vaccines that are based upon a kill version of the virus. We have vaccines that are based upon our understanding of the genetic makeup of the virus and the proteins that it makes. So you'll hear in the public domain talk or conversation about the so-called spike protein, which is a very important protein that the virus makes to allow it to attach to human cells. And most of the vaccines that are in existence are actually capable of creating what we call antibodies or chemicals that block that interaction. So what it basically means is that if we identify a new virus, for example, that is likely to be able to produce an epidemic, we can use these sort of protocol or strategies to create new vaccines, because we now can sequence the genetic makeup very quickly. We can understand all the chemicals it produces. We can go back to the old-fashioned way of neutralizing them through radiation or heat. So we have quite a bit of a platform to work with.
Given historic events, what should we expect from a public health management viewpoint from the initial rollout of the vaccine and beyond?
All right. So herd immunity is really a concept whereby what we're saying is that if there's sufficient persons in a particular area that have immunity against an infectious agent, then it becomes difficult for that infectious agent to take hold. Because if the agent finds somebody who's susceptible to it, it tends to kind of be spread into another person because that other person is immune. So ultimately, it will die out. So the concept of herd immunity is something that we seek to achieve in a group of individuals when it comes to any infectious agent. So what the world is trying to do at this point in time is to ensure that there's sufficient number of persons worldwide that have immunity, whether natural because they've gotten the infection, or through technology, which is through the vaccine, so that if somebody who is susceptible gets the infection, then there's nobody for it to spread to. And so that's really the goal of most of our public health initiative. In the interim, until we get to that level, what we're trying to do is to minimize the spread from individuals to individuals through the standard, what we call public health strategies, which are infection control and prevention, which means wash your hands, sanitize your hands, face coverings because it's a respiratory virus, keep your distance away from individuals so that you don't transmit it relatively easily. So those are what we call standard sets of measures for infectious agents, especially respiratory agents. And those will continue hand in hand until, as I said, sufficient number of individuals have the immunity, whether through natural means or through a vaccine.
So, Professor Reid, is there anything else you'd like to add?
So from our side, we're biased, being healthcare providers, we're biased. As it stands now, this particular epidemic puts us at increased risk, and many of my colleagues have unfortunately died, both here in Jamaica and worldwide. So we have a particular biased view as it relates to this, whereby we would wish that as many persons as possible would take vaccines so that they can get the necessary immunity to allow us to work more confidently without fear or the threat of this particular infectious agent being a problem for us. And so I think almost any healthcare worker that you take worldwide, that would be their wish. As I said, science has brought the world to this particular level of development, both when you look at science in terms of the physical part of it, like on here, I mean things like cars, bus, trains, just the way we do things through technology, all of those represent scientific advancement. We accept those as part of the natural way of doing things. Yet and we accept that if we have a cancer or if we have high blood pressure, diabetes, the medications that we have created for those, we accept them to say that they will make us better. And so for me, it's a bit puzzling. Having accepted those, why, and we've accepted previous vaccines, whether you speak about the polio vaccine, you speak about the measles vaccine, we accept those. And so for me, if it is that you have accepted all of those issues, which is what science has done for you, I'm a little concerned if it is now that, flipping to say science is now coming to do harm to you through the development of a COVID vaccine. So from my side, my encouragement to everyone is as soon as you're in the queue, as soon as it's available for you, try and access it.
Thanks so much for joining us today, Professor Reid.
Not a problem.
And to our viewers, thanks for watching. Connect with us. Follow us on Instagram or Facebook at GetThePH. And we leave you with today's inspirational quote. Health is a soul that animates all the enjoyments of life, which fade and are tasteless without it.